So our first presentation this evening is Dr. Paul, as you mentioned, and that is an update on the Nav Centre's quarantine.
So welcome to Council, Dr. Paul Roumeliotis from the Eastern Ontario Health Unit. We're very happy to have you here. Thank you for attending on short notice. I find it important that you be here and that you be able to brief everyone,
Yes.
but also Council in particular. And so welcome.
Thank you very much, and good evening, everyone. Bonsoir tout le monde. I'm going to start by giving you a bit of a historical background of how we ended up today and how we first started with the story, and then I'm going to talk to you about some of the messaging that I've been actually quoted nationally on in terms of trying to, clarify rumors and sort of set the situation straight. So first of all, I found out last Saturday. My colleagues from Ontario called me and said that Nav Centre would be receiving, and I said, well, okay, let's get the details, and maybe tomorrow I'll do a site visit. But unbeknownst to me, they published that evening, they had a press release and actually said that they're coming to Cornwall. And so that took us a bit off stride. I'm not surprised that they chose Cornwall, the Nav Centre, because as you know, we've hosted many types of large number of evacuees. So I wasn't surprised at that, but I was really surprised that they announced it without us even getting to do a site visit. So I spoke to the mayor, and the next morning I visited the site and ascertained indeed that there is a separable building. Quarantine is possible in that. That's what I ascertained. Safe quarantine is possible, separate building, separate ventilation, and so on. As a backdrop to that, I just want to say that I was made aware of this COVID 2019 now on December 31st. On New Year's Eve. We had an email from the Chief Medical Officer of Health saying that they'd had 59 cases of pneumonia that clustered out of a Wuhan animal market. And so, we sort of knew about it. January 10th, we said that we started seeing the numbers go up. We sent a memo to our hospitals around saying, if you have any patient that shows up that had traveled recently to this part of China, please ensure you call us, take the necessary precautions, because we're not even sure what's going on, but we know there's a cluster. Very quickly afterwards, we found that it was this new novel coronavirus, and they've changed the name. The coronavirus family is very common. We see it as the common cold. This one came from animals, probably bats, we're not sure. And they mutate, and then they're able to infect humans. And they're called novel viruses because they've never infected humans before. And they inherit the potential to infect one another, one human to another. Usually animal viruses, if they infect a human being, they just stop there. They don't go anywhere else. But they mutate, and that's why they become novel. And they're novel because we've never seen them before. So our body doesn't have any immune memory, if you like. So then it overwhelms, like any other cold, like the flu, more the elderly, more people with underlying chronic medical conditions, and usually children. And in this situation, it actually spares children. It's more elderly and people with underlying medical issues. 83% have minimal to no symptoms, like a cold, but these, 17% are suffering and having complications of it, which, by the way, we will see. If any individual who's 85 years old has multiple medical conditions, gets a cold, will suffer, may die, may have pneumonia or the flu. So that's not new to us. The novelty is, though, that many people are not immune to it yet. There's no treatment and there's no vaccine, so that's why these things spread so quickly. So at that time, we really revved up our monitoring. That's what public health does, revving up the monitoring, working with our partners, EMS, ambulance, and so on, and keeping them updated. And then, we started getting, first case, second case in Ontario, which were expected because there were people coming back from that area. But still, at that point, I was quoted, and I had written in this freeholder that the risk is low in our area, and the risk remains low today. We've never had a case, including over the weekend. We've never had any cases here. So that's the backdrop. So then going back to visit the quarantine headquarters, completely separated building, like an ideal situation if you were to ask, if you were to do it in an area. Now, we ascertained as well that no Nav Centre employee is going to go into the area. This is going to be fully manned, like it was in Trenton. Don't forget there was a Trenton operation, and the Trenton operation was full. That's why they didn't go to Trenton. The Trenton operation had Red Cross workers, Army, PHAC workers, Public Health Agency workers, and the Emergency Management Medical Assessment Team, which is like a MASH unit from Ontario. They were all on site, provided services, tested everybody. And none of them to date, actually they were released today, the second quarantine, developed any illnesses. Now these individuals came from China, from the Wuhan area. They were not on the cruise ship. So then we have this other cohort with the cruise ship coming to Cornwall, and then in terms of the quarantine, like I said, I just want to go back to that. I want to stipulate that the quarantine, like I said, there's no ventilation connection. It's completely walled off. It's actually a tunnel that leads to it, which is an ideal place because usually we want to have a clean space to change and mask and so on. It's a respiratory droplet. It's not respiratory spread. It's respiratory droplet. So, for example, if I have a virus, I'm speaking now, or I can cough, it'll go maybe 6-7 feet, but it'll drop on the ground. It'll stay there. It'll stay on the surface. If I happen to touch it, I may infect myself and so on. But it's not going to be airborne and go into ventilation like certain viruses do. Other viruses, other bacteria, TB, for example, and those type of things. So it's a droplet spread, and we know, so we understand today, the current science, is that it spreads from one person to another, close contact. Okay, so now we go to the Nav Centre. We visited the premises. We met with PHAC, Public Health Agency of Canada, the Army, and so on. All the procedures are in place. And I remain, and I've said it many times before, that the risk to people working at Nav Centre and the people visiting Nav Centre is not increased. It's the same as it was yesterday when they weren't here. And so the issue is that no Nav Centre employee enters that zone. I've been there, the mayor has been there, we visited it, it's cordoned off. Everything is done on site. There's a medical clinic on site. It's available during the day, and now there's going to be overnight coverage. And so today, by the way, I will be proactive. There was an ambulance that went, but it was somebody that had a medical condition not related at all to any COVID-19 virus. And we have procedures in place. We've done this before for flu and everything like that. We have procedures in place that maintain isolation and infection control all the way from transferring, from a patient's room to the hospital, the ambulance, and so on. And I've worked in ICUs for many years of my life as a pediatrician and working in hospitals since 1979, where we dealt with very deadly infections, and we took care of the patients and washed our hands and wore the masks and went and ate in the cafeteria. Didn't infect anybody, right? So, and we had contact with these patients. So these are people at Nav Centre. And the reason I say that is because the Nav Centre employees were quite worried, and I spent a lot of time speaking to them. And I'm also getting phone calls from schools saying the kids are being bullied now because their parents work at Nav Centre. Some parents are refusing to send their kids to daycare and to schools because their parents go to work at Nav Centre. And that I will be addressing tomorrow. Letters will go out to all parents to explain that. There's absolutely no risk to them. There's no way that somebody working in, my God, 1,000 meters away from the quarantine zone, which is blocked off completely, can transfer that virus. There's no way. The virus is contained in the area. They wear masks, they wear procedures. The routine of the passengers, by the way, the passengers are 50 and over, average probably 75. It's an older cohort. So they're going to need some medical, some of them have chronic medical conditions. So yes, we do have on site. We're trying to keep them on site. And if we do, and the thing is, I want to tell people, if an ambulance goes and picks them up, doesn't mean they're going there for a COVID virus. In Trenton, all the ones that went to hospital were actually not related to COVID. They were, fainting spells, heart issues, and so on. So I'm moving forward. We have now, it's been, day 3 now, I think it is, of quarantine, where I've been there almost every day. So is the mayor. I've seen the infection control protocols. And by the way, how is local public health? I want to tell you the chain of command here. This is a federal operation, the Public Health Agency of Canada. And we're collaborating at the local level, to start to work with the mayor and others to have local communications, but very importantly as well, we train and oversee all of the infection control protocols that they have. Our staff went and trained some of the Army people to ensure that they put the masks on properly. We have people on site to ensure that the Red Cross is wearing the masks properly. Because don't forget, it's going in that you got to be protected, and then coming out, you got to be completely clean. So, and that's what we're doing. So the in and outs of that. The routines of the individuals, who, by the way, I feel very bad for because they've been through a big ordeal. Essentially, they're in their rooms. They are not allowed to go to the rest of everything's warded off. They're not allowed to go anywhere else. If they leave their room, they're to wear masks and gloves. They are not to congregate. They can go outside and sort of supervise to make sure they're not close to anybody for periods of time. And then, again, wearing masks and gloves. All of the support services, laundry, linen, cleaning of rooms, disinfection is done by a third party that does it for hospitals and has been doing it for Trenton. Again, no Nav Centre worker. Food is prepared on site, but is delivered through a tunnel. And we've got a clean room and a sort of a transfer in the tunnel. And I think the mayor has seen it as well. And it kind of goes into a neutral zone, and it's all in boxes, in cardboard boxes, with disposable utensils. The laundry of the individuals is done by themselves, by the individuals, and stays on site. So you can see that it's all self-contained, and there really is no, to my mind, no increased risk of the presence neither to visitors at Nav Centre or employees or to the surrounding area. And I've said that time and time again. I'm actually, frankly, more worried about flu. We've had 9 or 10 flu outbreaks in our area recently, and we've had 3 in daycares as well. I'm more concerned about that. So washing our hands, sneezing into our sleeves, coughing into our sleeves will protect us from that and the COVID virus. Now, I also want to tell you that we are a bit concerned about the number of countries, because I get the situation updates on a daily basis, and I've actually shared it with a lot of the mayors. I share it. We have daily updates on that that are separate from our public updates as well. We've seen now it's close to 80,000 cases, I think, in China, close to 3,000 deaths. But we're seeing some clusters in Italy. We're seeing clusters in Iran. We're seeing clusters in South Korea. So the United Nations and the World Health Organization is keeping a close eye on that. I'm frankly more worried about that than I'm worried about the situation here, I'll be honest with you. For now, however, our risk in Canada, our risk in Eastern Ontario, with or without the passengers at the Nav Centre, remains low. And that's what the message I have.